All right, welcome back to ABA Exam Review, where we're going through our fourth BCBA practice exam. We're going through the next set of questions together, breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials. When you pass your exam, let us know so we can include you in our Sunday shout out. Other than that, let's work hard, study hard, get to our questions. 161, sitting in the kitchen. Jameson overhears his parents say that it might rain all weekend. Later that day, Jameson's friends say they should go to the park this weekend. Jameson tells his friend that it might rain all weekend. Jameson telling his friend represents blank. All right, so whose behavior are we looking at? And that's our key, or one of the keys, when we have these behavioral questions with a lot of moving parts. So we know we were looking at Jameson telling his friend. That's what we're keyed in on. Okay. What happens prior to that? Well, Jameson overhears his parents say it might rain all weekend. Later, Jameson's friend says, "Hey, we should go to the park." Jameson responds by saying, "It might rain all weekend." Now, what might throw you off initially is Jameson answers his friend with exactly what his parents said earlier. However, why is this not an echoic? And why is this not imitation? Well, it's not imitation because it did not happen immediately after the model. And that's one of the keys with imitation. Imitation has to happen immediately after the model does something. So it can't be imitation. He can't be imitating because it happened way later that day. Same with the echoic. The echoic is evoked by that verbal SD, but what evoked Jameson's behavior here? It wasn't the parents saying it might rain all weekend. It was Jameson's friend saying, "Let's go to the park." So since Jameson's friend evoked Jameson telling his friend it might rain all weekend, and since there is no point-to-point correspondence, it can't be an echoic. It must be an interverbal. Remember, an impure tact is essentially a mand and a tact combined. It's evoked by both an MO and a nonverbal SD. Now, what's happening here? What occurred and why you need to know the ins and outs of our verbal operants is that Jameson's telling his friend behavior was evoked by a verbal SD, and the response that it might rain has formal similarity, but it lacks point to point, making Jameson telling his friend an interverbal. Pretty straightforward question, but there's a lot of moving parts there. So it's a good learning question. Make sure you understand why it's an interverbal and why it isn't the other three. If you can answer correctly and then identify why the other answers are wrong, you're really building up that skill set. 162. You are a behavior analyst supervising a technician at a new client's first session. You've already conducted the FBA and have a plan written, so now you are going to walk the technician through the plan. At one point, the client's mom walks in and says the client started pulling on his ears with force. This was never mentioned during the initial FBA. What should you do? You are the behavior analyst. Put yourself in the shoes of a BA. You are at this client's first session. You've already done the FBA. You've got this plan written, and now you're going to walk the technician through. Suddenly, the client's mom walks in and says now he's pulling on his ears with force. Well, this was never mentioned during the initial FBA. Immediately when this pops in your mind, your first thought should be what? Well, your first thought really should be medical, right? Because we always need to rule out medical causes before we attempt behavioral causes, especially when there's ear tugging or head banging or bedwetting or these things that can be signs and symptoms of other medical issues. And we're not medical doctors, we're not MDs, we can't diagnose it, but we can consult the parents to do what's best for their kid. So in this case, since it was never mentioned during the initial FBA, what do? A, instruct the technician to block ear pulling and reinforce when the client is not ear pulling. Well, you don't want to jump into an intervention. You haven't even evaluated its behavior. You haven't seen the behavior. You've just been told about it. So jumping to the intervention is the last thing we want to do. B, ask the parents if there is any medical history associated with ear pulling. Good. This is going to be the first step in our assessment, right? Now we're going to do an indirect assessment quickly. Is there medical history? Yes. Okay. What is it? No. Well, maybe we need to get this checked out, right? Because all of a sudden, they've started doing this behavior and the parent never mentioned it before. It was never seen before. So it's a brand new behavior pulling on ears with force. We need to first rule out that medical history and the medical problem before we proceed. C, you need to do another full FBA if this behavior was not identified initially. No, you're always going to miss something in your initial FBA, right? There's too many variables in life, right? So you don't need to conduct this full FBA again. We just now need to focus on this behavior in particular. And then D, take action only once you have observed the ear pulling. Well, not necessarily. We're not going to intervene until we've seen it and assessed it, but we can certainly rule out medical problems, and we can certainly get a client history on the issue. So the first thing we need to do is ask the parents if there's any medical history associated with ear pulling. 163, a behavior analyst, at the request of the client's father, designs a plan to teach the client to eat pizza using a fork. The behavior analyst defines the behavior and is able to decrease the behavior through intervention. What dimension of ABA might this scenario lack? Okay, so let's break this down. It's a dimension question, which on the surface appear easy, but they can get pretty complicated just the way these questions are worded, right? Because the dimensions often overlap. So we've got to be very careful here. What we know is the behavior analyst, at the request of the client's father, designs a plan to teach the client to eat pizza using a fork. So that's our goal, right? Eat pizza using a fork. The behavior analyst defines the behavior, so we know it's behavioral. They are able to decrease the behavior, okay? So it's effective through intervention, right? So it's analytic. So what dimension might it lack? Well, let's look at A, applied. Is teaching the client to eat pizza using a fork socially valid? Is it meaningful? Is it going to change their life and the dad's life in this meaningful way? Maybe, maybe not, right? It's really not a socially valid behavior in the first place because most people don't eat pizza using a fork. So to say this is an applied behavior, it might not be, right? So A, it might be lacking. B, analytic. Well, we have a functional relation, right? Because we're able to decrease the behavior through intervention. C, behavioral. We define the behavior. And then effective. Well, we were able to decrease it. So what dimension might we lack is this applied? Is it really necessary to teach the client to eat pizza using a fork? Is there nothing more meaningful in his life to teach at that point? That's what we have to ask ourselves when we describe an applied behavior. A hockey coach wants to increase his team's ability to score goals as well as their confidence. He brings out a hockey goal that is 3 times as big as the normal goal and says, take some shots on the goal. He then reduces the size of the goal and says, take some more shots. What type of prompting is this? 2 major types of prompting: response prompts, stimulus prompts. 2 major strategies: most to least, least to most. That's where you should always start with our prompting questions. In this case, ask yourself, are we acting on the response or are we manipulating the stimulus? Well, the coach wants to increase his team's ability to score goals, so he brings out this hockey goal that is 3 times as big as normal. So he's changing the size of the stimulus. That tells you what? Well, it tells you it's a stimulus prompt because he then continues on and reduces the size of the goal. So he's sitting there manipulating the size of this stimulus, right, to evoke the response. It's a stimulus prompt. Is he least to most or most to least? Well, no, he hasn't changed the type of prompt, right? He hasn't gone from a physical to a gestural or a vocal to a model. He's just changing the stimulus. He's just altering the stimulus to prompt out what he wants to see. Now C, movement prompt. Be very careful. Movement prompt is just another way to say a gestural prompt. That's pointing or gesturing or nudging, right? Not what he's doing here, okay? He is manipulating this stimulus, this hockey goal, to evoke the behavior he wants to see. So the type of prompting he's using is a stimulus prompt. Always ask yourself in the prompting questions, all right? Think about, am I acting on the response for the stimulus? And then is there any most to least or least to most going on? Kind of start there and work your way from there. 165, a behavior analyst is contracted to work with a school for the gifted and talented. The school wants the children to use more complex words in their sentences. If the behavior analyst designs an intervention and then takes baseline data, when should she not recommend that intervention begin? Okay, pretty basic question here as far as baseline goes, right? It's a fundamental question is what I mean. This is a very fundamental idea. What do we know? We know that the behavior analyst is working with the school for the gifted and talented. The question wants to know, when should she not recommend, keyword not, intervention begin? The goal is to get the children to use more complex words and sentences. So we're trying to increase something, right? They design an intervention and take baseline. So when should she not recommend that intervention begin? If the goal is to what? Increase something. A, whenever the baseline becomes stable. Well, when baseline becomes stable, that's what we're looking for, right? When baseline is stable, boom, let's begin that intervention. B, whenever the baseline starts to decrease. Well, if the baseline starts to decrease, then that behavior we're targeting is getting worse. Let's get the intervention going, right? C, whenever the baseline starts to increase. Well, our goal is to increase the behavior. If that behavior is already increasing, there might not need any intervention at all, right? If the behavior is already increasing and our goal is to increase, maybe we don't recommend it, right? That's when we don't recommend the intervention begin. Let's see what happens because maybe that behavior gets to where we need it to go without any intervention. So if the baseline is stable, recommend. If the baseline starts to decrease, recommend. But since our goal is to increase already, if that baseline is already increasing, don't recommend the intervention begin. Our answer is C. And that would be the opposite if we're trying to decrease something, right? If we're trying to decrease something and our baseline is already decreasing, there's probably not a reason to intervene. And of course, nothing is necessarily black and white, but generally that is the rule of thumb. 166. Gordon's chef hat is blown off his head suddenly by a huge gust of wind. This represents a what? All right, back to basics here. Back to the dead man's test. Back to what is a behavior. Here we are. Gordon's chef hat is blown off his head suddenly by a huge gust of wind. Is this a public behavior, private behavior, no behavior, or unable to determine? We are able to determine, so we get rid of D. Is this a public or private behavior? Or is it even a behavior? Could a chef's hat be blown off a dead man? Sure. And that's where the dead man's test comes into play, right? It's the basis of when we are identifying a behavior. If we put a hat on a dead man and wind blows, that hat is gone. Gordon did nothing here, right? He was, who knows, walking, sitting, standing. We don't know. All we know is his hat was blown off. This is not a behavior. Gordon didn't do anything, right? If a dead man can do it, it isn't a behavior. Don't forget the dead man's test. Don't forget the basics. That's what I'm trying to preach here, all right? People struggle sometimes because they forget the basics. They get caught up in the harder things. We cannot neglect our basic fundamentals. 167, a nonverbal girl with autism frequently experiences stomach pains. Her mom shows her how to point to her stomach with 2 fingers whenever she feels pain. What is the mom teaching the girl to do? So what is the mom teaching the girl to do? Well, communicate, obviously. What kind of communication are we looking at? We know she's nonverbal and has stomach pains. Her mom says, point to your stomach, or shows her with 2 fingers whenever she feels pain. So when that pain occurs, she points to her stomach. Is the mom teaching her to mand for medicine? No, nowhere in the question have we talked about asking for anything or medicine whatsoever. All we're talking about is identifying stomach pain. So if we're trying to identify stomach pain, are we tacking a private event? Absolutely, right? We were labeling this private internal event that the mom can't see. This is a very, very important skill for nonverbal individuals. You have to be able to identify pain because we can't see pain. What the mom is doing is showing her how to tact her pain. See, use picture exchange communication system. Well, clearly not PECS. There is no picture involved. And then D, respond to interverbals. If the question had said, whenever the mom asks, do you feel pain? The girl then points, that would be a different story, right? But that is not the case. All the mom wants her to do is identify or label when she has pain. So she wants her to tact a private event. 168, Lucy tells Charlie that she will hold a football still while he runs and kicks the football. Charlie says no, because you always pull the football away before I kick it. However, Lucy is able to get Charlie to do it anyway after some convincing. Pulling the football away when Charlie attempts to kick acts as a what? All right, what are we looking at? What behavior? We're looking at Lucy pulling the football away when Charlie attempts to kick. Okay, so we know that Charlie doesn't want to do it, but Lucy still gets Charlie to do it anyway. So pulling the football away is doing what? When we're identifying or evaluating consequences for their properties, we have to ask ourselves, how is the behavior changing, right? Is that behavior increasing or is it decreasing? In this case, has Charlie's behavior changed? Well, we know Charlie does it in the past, right? She knows because you always pull it away, and yet he continues to do it. The behavior hasn't changed at all. So it's not punishing him, but it's not reinforcing him either. Okay. He's still fighting it. Okay. The behavior just hasn't changed at all. So it's not a reinforcer or a punisher because it hasn't changed anything about future behavior. It is a consequence, though. It's still a consequence. It can be a consequence, right? The antecedent is putting the football down. Charlie attempts to kick, pulls the football away, right? ABC. The only thing is it has no reinforcing or punishing properties. It's simply just a consequence. It's obviously not an antecedent because it occurs after kick. So our answer here is going to be pulling the football away when Charlie attempts to kick acts as a consequence. Research that is conducted in a controlled environment, such as a laboratory, falls into what domain? So our 4 domains of behavior, 4 domains of behavior analysis, however you want to think about them: philosophy of behaviorism, experimental analysis of behavior, applied behavior analysis, and professional practice of behavior analysis. Philosophy of behaviorism is thinking about behavior and discussing it, the thoughts and ideas that shape behaviorism. Applied behavior analysis is what we do, right? It's applied research on humans in the field in real settings. And then professional practice of behavior analysis is the implementation of the research we do, right? The implementation of our treatments and our interventions. So experimental analysis of behavior, which is what B.F. Skinner originally did, is research, basic research, right? It's conducted in a controlled environment, usually a laboratory, right? That just studies behavior. Once we get out of that lab, once we get out of that controlled environment, and we start getting into the real world, then we're talking about applied behavior analysis. But basic research, controlled environment, laboratory, as always, experimental analysis of behavior. 170. Which of the following phrases used to describe someone's behavior would be incorrect due to the utilization of an explanatory fiction? Mentalisms, right? When we talk about mentalisms, these are internal constructs used to explain away a behavior. We can't observe them. We can't manipulate them, but we describe them anyway. Mentalisms, the 2 major ones, are our hypothetical constructs and our explanatory fictions. We also have our circular reasoning. Now, when you think about hypothetical constructs and explanatory fictions, the constructs, think of those as our terms, right? Willpower, confidence, fear. These are our terms. An explanatory fiction is using those terms to describe why a behavior is occurring. So if we are describing behavior, what would be incorrect because we used an explanatory fiction? In other words, which one of these is a scenario where an explanatory fiction is used to describe why a behavior is occurring? A, Lisa has been burned in the past, so she carefully lights the fireplace. Okay, well, why does she carefully light the fireplace? She's burned in the past. That is not an explanatory fiction. That's what really happened, right? B, Lisa nervously lights the fireplace because she has been burned in the past. Again, she lights the fireplace because she has been burned in the past. Describing Lisa's behavior as nervous is not an explanatory fiction. It becomes an explanatory fiction when you attribute why that behavior occurs, right, to the term. Meaning, look at C. Lisa has been burned in the past, so she carefully lights the fireplace because of her nerves. Now we have an explanatory fiction. Although she's been burned in the past, we're saying she lights the fireplace because of her nerves, not because of the consequence of the past. That is an explanatory fiction. You have to understand that, right? We can say she nervously lights the fireplace. Okay. We can say she carefully lights the fireplace because we're not saying that's why she's lighting the fireplace that way. When we say she lights the fireplace that way because of nerves, that's when we get into that explanatory fiction territory. Great. Check out behavioranalyststudy.com for all of our study materials. We are almost done with exam 4, and then we'll move on to our next one. So be sure to like and subscribe. As always, let us know when you pass. Work hard, study hard. See you soon.